I'm here with Dr. Brown, Dr. Erica Brown. She's the local health authority for Harris County, and is with Harris County Public Health. We have a piece of good news this morning, good news that I'm announcing. Those of you who follow my actions and the actions of our department know that we are on the side of caution, of information, of leaning forward, and we've made a promise to always be transparent and bring awareness to what's happening in our community. When we were alerted last week that a child in our community was a presumptive positive, we took all the necessary steps to immediately inform the community, to mitigate exposure, to contact trace, to try to identify anybody else who might have been might have contracted the virus. As I mentioned the day we made the announcement, we send some of our samples to the CDC. That's what jurisdictions all over the country do. About 10 to 15% of the monkeypox tests that we do here locally are sent to the CDC, and they test to verify that in fact that is the virus they've tested for. When we do that with COVID, for example, they let us know which variant it is. We only send about 10 to 15% of the samples because of capacity limitations that the CDC has. I am pleased to announce we learned from the CDC that the child in fact did not have monkeypox. So the case, we believe, was a false positive. False positives do happen. They're very rare. We hadn't had a false positive. This is the first one we've had with monkeypox. Of all the samples we've sent to the CDC, they all come back that in fact it was a positive. So that's what I shared last week. But this time they came back and they said in fact this case was a negative. The false positives only happen around 4% of the time. And I'm glad we followed best practices by assuming the child was positive until proven otherwise. This is still the best way to protect our community, is to act based on the information that we have. And as I said, false positives are very, very rare. There have been confirmed cases among children in the United States, including in Florida, in New York, in California. So children are still able to get the virus, but thankfully, we need to still keep working in Harris County, and we can keep working in Harris County to keep children, or at least identified cases, from taking place in the community of our youngest residents. So overall, obviously it's good news to know that as far as we can tell, monkeypox remains mostly concentrated in the groups we focused our response efforts on, and it has not spread to kids yet. So it's time to be vigilant, to get ahead of the virus, to surround it by ensuring that the population most at risk is vaccinated. But we're not at a position where we have reason to believe that kids are at any more risk than they were, say, 2 weeks ago. So as before this case, we know that kids could get it, but we have not definitively identified a case in Harris County, and we're very relieved to hear that. Of course, the family's very relieved as well. So that's one piece. In addition, another piece of good news, I'd like to give an update on the expansion of monkeypox vaccine eligibility. Our goal is still to get as many people who qualify vaccinated as quickly as possible. We've always felt that vaccines are the key to eradicating monkeypox, and the expansion of criteria are what helps us defeat this virus. So today we're expanding eligibility, and we need the community's help spreading the word so we don't get to a situation where the virus spreads further throughout the community. So we're expanding eligibility to men who have sex with men, and we especially call on men who have sex with men who also have multiple or any anonymous sex partners. But help us spread the word. If you fall under this category, call us, set up an appointment. If you're not sure whether you meet the criteria, you can also call. The phone number is 832-927-0707. The full eligibility also includes people who are HIV positive, who are on HIV PrEP, people who've got a diagnosis of chlamydia, gonorrhea, or early syphilis. So it's good news that we're able to provide the vaccine to more populations. And together with the city, our health departments, our medical community, our larger community. We're working every day to learn as much as we can about this virus, to work to outsmart it, and try to stay ahead of it. Final piece of news for today's court, we're expected, I hope, we've got a proposal that is very, very exciting, very, very important, and I hope that my colleagues will join me in supporting a $20 million investment in behavioral and mental health today. We will have media availability heading your way later in the week if in fact we're able to pass that proposal, but it's very exciting, important for our community, especially in a state that ranks last in mental health. So let me repeat briefly in Spanish and then we'll hear from Dr. Brown. Tenemos buenas noticias esta mañana. Todos que me conocen nuestro Departamento de Salud Pública, saben que siempre trabajamos de una manera proactiva, con transparencia, con información. Por esa razón, la semana pasada, cuando nos enteramos que un pequeño, una pequeña de menor de 2 años era presunto positiva para el virus, la viruela del mono, le informamos a la comunidad inmediatamente. Tomamos esa muestra, salió positiva, se informó a la comunidad. Bueno, como anuncié aquel día, nosotros le enviamos un porcentaje de las muestras a la CDC, al gobierno federal. Un 10 a 15% de las muestras se envían para verificación. Eso lo hacen todas las jurisdicciones, todos los condados y las ciudades de nuestro país que tienen laboratorio. Y no se puede enviar más porque tiene capacidad limitada la CDC. Bueno, en fin, ellos revisaron la prueba y nos informaron que ese caso de hecho era un falso positivo. Es buena noticia, obviamente fue algo preocupante, pero es un alivio. Es el primer falso positivo que tenemos en el condado Harris. Hemos enviado ya bastantes pruebas a la CDC y todas habían confirmado el positivo. Eso lo dije la semana pasada, que todas habían salido positivas, entonces asumíamos que esta también iba a ser confirmada. Pero nos han dicho el día de ayer que de hecho era un falso positivo y este niño o niña no tenía la viruela del mono. Entonces todos descansamos un poco. Los falsos positivos suceden, pero sucede alrededor del 4% de los casos. Ya han habido casos en niños en otras partes de los Estados Unidos, en la Florida, en Nueva York, en California. O sea que sabemos que los niños sí pueden contraer el virus, pero hasta el día de hoy en la comunidad no tenemos confirmación definitiva que un niño o niña tenga la viruela del mono. Entonces es un alivio, tenemos que seguir trabajando para que eso no suceda y eso lo logramos al rodear el virus por medio de las vacunas a la población más afectada. Entonces hay una segunda pieza de buenas noticias y con esa meta en mente queremos expandir la elegibilidad, quién califica para la vacuna en nuestro condado Harris. El día de hoy estamos expandiendo la calificación a hombres que tienen sexo con hombres. Específicamente llamamos a aquellos hombres que tienen sexo con hombres y tienen parejas sexuales anónimas, pero realmente cualquier hombre que tenga sexo con hombres puede venir pedir la vacuna. Los invitamos a que nos ayuden con eso. Pueden llamar al 832-927-0707 para sacar la cita y para poderse vacunar. También puede recibir la vacuna si tiene VIH, si está en profilaxis de exposición al VIH, en un diagnóstico de clamidia, gonorrea o sífilis temprana. Toda la información está en el internet, readyharris.org o por teléfono. Y la línea está disponible en español. Entonces, son buenas noticias que podamos vacunar a más personas, que este niño o niña no sea positivo. Finalmente, es un día positivo para nosotros en cuanto a este virus. Espero que esta comunidad se vacune para poder avanzar. Y finalmente, quiero un corto anuncio acerca del tema de la salud mental. Sabemos que este estado es el último en los Estados Unidos en cuanto a salud mental. Hoy día hay una propuesta para casi $20 millones para atacar la salud mental, los temas y retos de salud mental en nuestra comunidad. Entonces espero que mis colegas nos acompañen al apoyar esta propuesta y si pasa la propuesta tendremos una rueda de prensa más tarde esta semana, a finales de la semana. Entonces lo dejo ahí. We're going to hear from Dr. Erica Brown.
Thank you, Judge. As mentioned earlier, we are excited to expand our criteria. Recall last week we expanded to those who are living with HIV. And this week we have adopted all of Department of State Health Services recommendations to expand to and include men who have sex with men, as well as anyone who has a skin condition known as atopic dermatitis and or eczema, and some other immunocompromising conditions. Again, this is an effort to make sure that we're doing all we can to prevent the spread of monkeypox in our community, and we'll continue to evaluate on a daily basis and determine next steps going forward. Thank you.
We'll take any questions.
So, Judge, with the expanded criteria for vaccines, how well do you think the county will be able to meet the increased demand? I know the supply of vaccines has been something that you said we don't have enough of at this point.
Yes, so the fact that we were able to multiply the dose, how many doses are in one vial, really helped us, and we hope it's a bit of an art in terms of making sure that demand meets supply. Right now, we want to try to get ahead of it. So far, we've been right on the edge, and we're saying that multiplication leaves us with around 9,000 doses. That's including first and second doses, and we want to see what the demand is. The good news and the reason we're willing to sort of lean forward in this way is we've been told by the federal government if we get through 85% of our allocation of that 9,000 that we have left, we can request more and they will send more. And that was something that wasn't certain in the past. They'd sort of given us some and then taken away some. And so we're at a place where we're saying, please come get vaccinated if you fall under this criteria, if you're a man who has sex with men. Please help us out, help your community out, put yourself in a safer situation by getting the vaccine, and we are ready. We've got some mobile vaccination sites, we've got fixed vaccination sites, we've got an expansion plan that we were already drawing up and building up for with the hope that we would receive more vaccines and have more demand. So now it's the turn of the community to do their part, and if we see an explosion of demand, we will adjust and we will ask the federal government for more vaccines, but frankly, that would be good news. And we also have experiences with COVID doing a randomized system, so that's also what we would probably move to. But right now we just have to see what the response from the community is going to be.
So given that change from the federal government, you feel like going forward, you feel more confident in being able to expand vaccination efforts and have a more steady supply, I guess?
Yes, that commitment that they made, that if we hit 85 to 90%, that was a game changer. And so if they abide by that, we're in a good place because we know that we're not going to give people first doses and then not have second doses to give them. So we're comfortable expending all of the doses, or most of them, 85%, and then getting another shipment so that we can meet that second dose commitment 4 weeks later.
And Judge, referencing the toddler, just to clarify, was it the CDC that determined that this was likely a false positive then? And then also, how is the child doing now?
Correct. The CDC determined that it was likely a false positive. So with COVID, we do the same thing. We take the sample here, and then some of them get sent to the CDC, and they confirm, yes, in fact, it was COVID, and it's this variant. With monkeypox, they say, yes, in fact, it was monkeypox, and in this case, they said, actually, we're not getting that same result. I know at the time, the most the child had was a rash, a little bit of a fever. The latest, I'll give an opportunity for Dr. Brown if you have any latest information. Yeah.
Thank you, Judge. We're unable to comment on the status of the child, but everything has surpassed.
You had mentioned 9,000 doses. Just to make sure I had it right, that means 4,500 people can get it. It's a 2-dose shot, correct?
Correct. But as I said, we're looking to spend 85% of that. So actually, we're hoping to get to the vast majority of that and then ask for another shipment to get those second doses. And we're just now beginning to administer the second doses because we're barely a month into having started vaccinating people against the virus.
And again, at this point, the county is administering the doses as 1/5 of what the old dose was. That's kind of the standard going forward now, right?
The recommendation was 1/5, but we've not been able to get 5 doses out of each vial. We've only been able to get 4 doses out of each vial. So it's all we have the same situation in the city. It doesn't seem to give us 5. So we're splitting it into 4, and we are giving it per the recommendation.
Any idea why there's that discrepancy? Why it's not
Sure. So it's not a discrepancy. It is very common when you have a vial and in drawing up, you have, because it's such a small dosage, it's 0.1 ml dosage, which is just as efficacious as the previous 0.5 ml. However, when you have such a small dosage, even a drop left in the vial contributes to that 5th dose, which is what we're unable to get.
I guess maybe another question either for the judge or Dr. Brown. Do you know the total number of cases so far of monkeypox in Harris County, and also the number of vaccines that have been administered so far?
I have the numbers here. Let me see if I can pull them up. So cases, we have 451 cases in Harris County, including Harris County outside the city of Houston and the city of Houston. And as far as vaccines, we have vaccinated 2,150 individuals with the first dose. That's only Harris County Public Health. The city of Houston has vaccinated, I would think, somewhere around that number, or perhaps more. I know that they have a higher concentration of the population that's currently at risk, but I don't have the numbers. All of those numbers are on our website, readyharris.org. Folks can always see those numbers, and we're working on putting out even more detailed graphics.
And judges, Commissioner's Court planning any steps today in regards specifically to monkeypox and the response to it?
We're waiting to see if the Public Health Department, if they're needing more resources for expansion of this testing. In the past court, we did commit an additional $1.5 or $1.7 million for them to ramp up testing, and I know they're running down information, so that might be something we could consider.
And Dr. Brown, can you talk a little bit more about just how these false positives happen? How was it that the child tested positive here, but the CDC was able to verify that the child was not positive?
Yes, so at this time, again, we're not commenting specifically on the pediatric case. We would like to, again, focus on the expansion of criteria and making sure that the public has access to education on readyharris.org, as well as access to our hotline at 832-927-0707.
Any other questions? Okay, thank you so much.